Exposure assessment. In exposure, you need to assess the patient for skin rashes, wounds, pressure injury, signs of infection, bruises, and skin changes. It is very important to protect the patient's privacy, dignity, and temperature control throughout. The first step of assessing exposure is to take the patient's temperature. In the OSCE, a tympanic probe is used to take the temperature of the patient. It is inserted into the ear. When taking the temperature of a patient, explain the process to the patient and check if they are wearing a hearing aid. Be sure to tell the patient what their temperature is and what it means before discarding the probe cover safely into a clinical waste bin, and then perform hand hygiene immediately. Record the patient's temperature on the news chart using a dot. Not all healthcare employers use a tympanic probe to assess temperature, so you will also need to be familiar with the equipment at your own workplace. Inspecting the skin integrity of the patient is a key part of the exposure assessment. If the patient is lying in a bed, you can ask the patient to lie on their side so that you can visually inspect their back, and ask them to roll their gown down or up to inspect their chest and legs. You can also use this as an opportunity to check any IVs, urinary catheters, and drains. If they are in the community, you could ask them to reveal their top half first, and then their bottom half, to make the process as dignified as possible. Risk factors for impaired skin integrity include obesity, immobility, pregnancy, smoking, cancer, allergies, and the contraceptive pill, as well as inherited factors. So as part of your exposure assessment, you should take a brief medical history. We recommend you learn this as the AMPLE acronym. A for allergies, M for medications, P for past medical history, L for last meal, E for events leading up to. So, you've taken all your observations on the patient. Now it's time to add up their final news score, so we can make an informed judgment on their overall health and how frequently they need to be monitored. Each of the observations you have input is associated with a score down at the bottom of the page. Total up the scores to come to a total reading, which you can populate at the bottom of the column. A news score of 0 would mean the patient would need to be monitored at least every 12 hours. If they received a score of 1 to 4, monitoring and observations would need to be conducted at least every 5 to 6 hours, or as their condition changes. If the patient receives a score of 3 in any single observation, for example, if they have a systolic BP of 85 or 90% on oxygen saturation, they would need to be assessed at least hourly, and their care needs to be escalated. Equally, if their news score is 5 or more, they would need to be assessed at least hourly, and their condition would need immediate and urgent escalation to the medical team. A news score of 7 or more would also require urgent medical attention and continuous monitoring. At this level, medical attention would need to be at registrar level, and moving the patient to a critical care unit should be considered. Tell the patient what the score means and what the next steps are in order to gain their consent. Tell the patient what the score means and what the next steps are in order to gain their consent. When totaling the scores, remember to ensure that you have added the date and time at the top of the column, as well as adding your initials, as this is a legal document.